mobilize resources towards ensuring that we are training 100%. Once we have 100% capacity human resource, then we can ensure that we are reaching every household moving forward. So what other activities are happening in capacity building? We realize that women are the most affected by household air pollution. And the decisions in terms of the energy to be used at households were being made by either themselves or the household heads who are the men. But for sustainable use, the women played a key role in ensuring that there was a sustainable use of clean energy because they were the main cooks in the households. So how do we ensure that these women are empowered? The Clean Air Africa will be developing tools and specific messaging for the household cooks to ensure that even as they use or utilize the cooking technologies, the clean cooking technologies, they understand that they have to use it sustainably to ensure that they leverage on the best health benefits. Because stacking or having two technologies, one dirty, one clean, then nullifies the health benefits that she or he would have gained from just using clean energy. So we'll also be tailor-making health messages for groups, special groups in the communities. We will do the same for churches. We'll do the same for children, just as we're already having children develop their own training tools, and also ensuring that we are reaching out to everyone. As I mentioned, we've only been able to train 2% of community health workforce. We'll wish to pilot and ensure that we are reaching out to more. And how do we do this? We want to digitalize. Someone mentioned that, how about we have a gadget that is just with someone on their arms and they're able to get information on the air quality. But we also want to ensure that we have reminders going with people wherever they are to ensure that there is a sustainable consciousness around air quality. So we will be converting training materials into a digital platform where someone can access it anywhere, wherever they are, and also have messaging videos and short messages where they can just look at it. Data has been a problem. We all acknowledge data is becoming a big deal, but the data is somewhere. So to ensure that we are having routine availability of data, Clean Air Africa will be working closely with the Ministry of Health to ensure that air quality and air indicators are embedded within the routine surveillance systems in the ministry. So in the ministry, we have the MOH 514, which is the first, MOH 513 is the first tool in the community, which feeds into MOH 514. MOH 514 feeds into MOH 515. So we want to ensure that the source information that's actually happening in the households is fed into MOH 514, which gets into the national DHIS system easily by just following the track. So we will be also working with the ministry, two divisions, the Division of Community Health and the Division of Environmental Health, to ensure that we have indicators into specific tools and specific tools and specific paper to report and ensure that we're having continuous surveillance data. These will be digitalized. Anyone will be able to access as long as they've requested to access the same data, because this is the Ministry of Health data, and we'll be able to have information in real-time basis. One beauty about this Module 14, these will be adopted in all our partner countries, in all the 5 partner countries. We are in conversation with the Rwanda Ministry of Health, Cameroon Ministry of Health, and the Ugandan Ministry of Health. So you will be able to see these running through and you'll have tools that have been tested, piloted, and ratified, just that you may want to go through the normal systems in the specific countries. But we are glad to report that Kenya has already taken the lead, and we hope everyone else will follow suit. In terms of capacity building, we are also, as mentioned, we will be developing a Sub-Saharan African Center of Excellence on Air Pollution. This will be based in Kemri, Center of Respiratory Disease Infection. One of the reasons why we are investing and having the Air Pollution Center of Excellence is because we have to ensure that there is data in terms of monitoring. And we've mentioned a lot in terms of how do we ensure that we are able to routinely measure and also report on the same. So the Center of Excellence comes in handy for the sub-Saharan African countries to ensure that we have best data, not just in terms of operationalizing the air pollution and giving quality data not just to the WHO but also for consumption in the locality, and ensuring that we have local data for local policies and local standards. So what will the Center of Excellence be able to achieve is that we want first not just to do the research bit, but also to influence policy in terms of what does it look like. So we'll be supporting the studies, but also measuring and supporting the Ministry of Health. The Ministry of Health has a major interest in what does it look like? Can we get the data? Can we understand? And also be able to report something to the WHO in the next 2 years when they'll be asking for fresh data. So through partnership with Valkyrie Air Monitoring Group, the staff, the research staff will be trained, but also will be training a cohort from the Ministry of Health to support the development of standards moving forward. I understand NEMBA will be reviewing their ambient air standards, but then we'll also want to see and how we can synergize and ensure that we are having both standards running concurrently. And other than that, that is the hardware that will have a whole setup of the Center of Excellence. We also want to support the software of the training systems within the Center of Excellence. So we'll be offering courses. One is the health practitioner training on air pollution, energy, and health. One of the things that the WHO identified is how do we reduce carbon footprint from the healthcare systems. And one of it is that there's an understanding that we need to utilize the clinician and the medical workforce to be the communicators of this information, because it's already happening within their context and they understand how it's happening. So we want to build the capacity of the health practitioners on air pollution, energy, and health, and how they're related. Someone mentioned until the healthcare workforce is able to recommend 2 clean cook stoves per week, we are not yet there, and so this will come in handy to ensure that we are having them have it as a prescription to to the patient. Then health communication and journalism. There is a gap in health journalism whereby information that could have been, we even in our conversation we realize that how are we communicating this information? Maybe as a scientist you may not be able to really break it down to the very level, but a journalist or a communication person can be able to understand and break it down. So the health communication and journalism course will be able to have a cohort of journalists who will be able to disseminate research, but also to communicate to the policymakers and the people who are involved. And lastly, health impact assessment. I am happy that we'll have a session tomorrow on health impact assessment. This is a start-off, and then we want to sustainably ensure that we are having health impact assessment information moving forward. The center will be able to offer that in 2 cohorts per year. And lastly, we are mentoring. There's a lot of mentorship cutting across the partner countries, and the UK, Cameroon, and all the partner countries are having partnership in terms of academic training and development of protocols, identifying the stakeholders and how to engage them and all that. So we are doing that as a unit. And lastly, I want to have a conversation around impact and management. Community engagement and involvement is a cross-cutting work package in our unit. So every researcher from all the work packages are members of community engagement and involvement. Why do we do that? It's because we want to ensure that every research, every strategy, every step all the way from development of protocols, collection of data, writing of reports and everything is involving the community. So we are maximizing on community engagement and involvement through the CEI Steering Committee, which is headed by Professor Were, the world leading expert in community-based empowerment and public health. And we are focusing at community entry, community participation, and also this is where we now want to document the success stories. What are the success stories in Cameroon? How did it look like? how are the success stories in Kenya, and even the fact that we do almost similar studies across the partnership, is that documenting the success stories and hearing it from different perspectives is helping us to ensure that how do we scale it moving forward, or how do we ensure that we are reaching out to more people as possible. So community engagement is the way to go in ensuring that we are not just reaching the policy makers, but we are also making sure that we are communicating with the people who are actually supposed to be implementing the policy, or assisting in ensuring that the policy has a success rate of, we're having 10% now, but at least we can rise that to more percentages. Yes, thank you so much.
Thank you so much, Nancy. Nancy is supported by 2 members of her team. Willa, who's seated at the back. I don't see Arthur. Is he around? He's online. Ah, okay, he's not with us today. So it's a team from KEMRI that's here with us. Are there any burning questions? I'll just take one because of time.
Thank you. The gravimetric filter weighing and analysis lab, is it already up and running? Because we are currently shipping these filters for analysis in France. So I would want to seize the opportunity if it's already running.
Our lab will be up and running by the end of, by the end of May. So we will be having, because it's one of the centers that we are looking to, it will be a WHO collaborative center, and so it has taken the interest of the Ministry of Health and the Office of the First Lady, because we understand that the office is running environmental activities. So we will be launching it in June, early June, the first week of June. So you're welcome.
Thank you so much. So again, the idea for this part of the conversation was, because I've seen some of your presentations already from the group discussion, there's things you've put on there that are either already being done. For example, Alex's question is very pertinent, because they as a city are doing source apportionment studies, they're running into issues here and there is another group here that's able to help with that. So just an opportunity for you to rethink what you're going to report back in terms of issues, so that we can have a broader conversation on where do we really need to target, not to duplicate or replicate what's already being done. That being said, the second group we wanted to engage was the Kenya Eastern Africa GeoHealth Hub. And we are lucky we have the 3 PIs with us. So I'm looking at you, Nick, because you're the host, to start us off. So for this, we just, give us a sense of, I'll come to you. Just give us a sense of, in your view, how are you sort of bridging that evidence to policy gap? How have you gone through that, and what are the challenges? And I'll go to Lynn, who is here with us, and Abera for the same, for Ethiopia and Uganda. Just briefly, maybe 2, 3, 5 minutes.
10.
Because of time,
No, it's
and
okay.
there's 3 of you.
Yeah, I think that's okay. Yeah, thank you very much. Now, I don't know where to start, but maybe just how we set up the GeoHealth in Nairobi, and how we are working, or we are trying to engage various stakeholders. So we work together with 10 schools, 10 primary schools within Nairobi, and we also work with 6 hospitals. The 10 schools, because we collect children lung health, we were doing children lung health study. So, but also that's where we've set up the low-cost sensors, which are the e-samplers. So that meant that some of our stakeholders involve the education sector. So we work with the Ministry of Health, Ministry of Education, Teacher Service Commission. Then, of course, the primary schools are under the Nairobi County government. We also, as I mentioned, 6 hospitals. The 2 public hospitals are Mama Lucy Kibaki Hospital and Bagathi Hospital. And then we have private hospital like the Nairobi Hospital, the Aga Khan University Hospital, and we also have the Metropolitan Hospital and Mata Hospital as well. So that's where we are getting the information that will help us determine the health impacts of air pollution in Nairobi. Of course, we are collecting respiratory and cardiovascular information from those 6 hospitals. Now, in terms of the policymakers, we try to engage with the Ministry of Health, and we started off well because Dr. Mutari was there. Then he quit the ministry, so it's taken us a bit to get somebody who can commit as much as he was committed to the cause. So we've had a few officers involved, and unfortunately they don't always turn up for engagement meetings sometimes, but we are working on that. The National Environment Management Authority, we are trying to forge a closer working relationship, and as they are revising the air pollution regulation, we are going to support them with our data. And the good thing is that the engagements we've had with them, they did recognize that we have a resource that will be useful to them, since we've been collecting hourly data for the last 3.5 years. Yeah? So we have 44 months of data, over 30,000 hours of data, continuous collection. And this is using reference monitor. So I think it's going to be very useful data that we can share with the National Environment Management Authority. But in engaging with them, I think they've been quite good, at least at even up to the Director General level, because he actually came to our last stakeholder engagement meeting and gave a keynote speech and showed interest in continue working together. Ministry of Environment, since Alice left there, it's been difficult to get somebody to work with there, but they do respond to letters we write, but we've never seen them come physically to participate. We work also, the Nairobi County Government, we've been working together, and actually they come to our stakeholder engagement meetings and also give their opinion about things. So it's a team that when we started engaging with them, they were just finalizing the policy and the law and the regulation on air pollution. Of course, they were supported by Stockholm Environmental Institute, who we also engage with to some extent. So I must say that maybe the biggest challenge with engaging the stakeholders would be, to get the committed persons among those group that perhaps we can have regular engagement with. Because if you do, then you seem to work better under those circumstances. But that aside, it's still important to engage as an institution, not necessarily reliant on an individual. And I think we learned from having lost Dr. Mutari. When he left, we floated a little bit before we could get another entry point. I think maybe that's what I can say for now, and if there are questions, I can respond to.
Yeah, so thank you so much. I will come to you, Lynn, next, just to some brief remarks on how you're bridging the science policy through the GeoHealth Hub work in Uganda. Oh, you have a graph? Okay, let's try that. I'm trying to make it brief so that we can listen from the groups as well. So I'll afford you that luxury. Is it just one slide?
Yes.
Okay.
Yes, I thought that being afternoon, it might be good to just show just some, maybe 3 graphs. And one of them is that we have been collecting data from hospitals in Kampala, and we are taking them from 5 large hospitals, mobility, mortality, but also have been monitoring data, monitoring using the BAM for now a long time. And as you can see, our collaborators are here, and we have the BAM 1022, which we clean and make sure we get our data smart. It's a strong partnership between the universities, as Professor Guge has quite elaborated. But I thought I should illustrate that during the COVID time in Kampala, we had we had acceptable air pollution, and good air, clean air, but also our spikes, December, January, and Feb, usually have more PM2.5. This is Nairobi, and this is Addis. They also, during the lockdown, as you can see, they have the lowest pollution vehicular. And now this is the Kampala one. You can see the green here. The green is actually, below 15, and sometimes below 5 during the stringent lockdown, meaning that for policymakers, if we did our best, maybe we could achieve some of the interim targets for Uganda. So we think partnerships with universities and policymakers and stakeholders is a very good thing to happen. And now we are phasing into we are now in the second phase, and we are going to be monitoring in Kampala, and cities shall have 2 monitors per sub-city and continuously monitor. So for the policymaker here, you are lucky that we shall now keep these monitors. They are high quality, as opposed to other sensors that that may require a bit more work. So I wanted to thank you very much for listening to me and attend to questions. I hope I have my one slide.
Perfect timing. Thank you so much. I wanted to come to you. Abera next. Okay. So Lynn, you have inspired. Yeah. So I'll give you maybe.
But this is not going to fit. Okay, so unfortunately I had a few slides, but I will speak out as much as possible. This Joel's project was commenced sometimes 2012, when we had so-called planning grant. This planning grant, it's for 3 years, where we are able to generate evidences in terms of showing gaps in air pollution and health. And this what we call situational data analysis was very effective across the 4 cities: Addis Ababa, Kampala, Nairobi, and Kigali. That took us in terms of winning the project for cycle 1 and cycle 2. Mainly we are involved in terms of generating evidences that associates, the air pollution and also health, which will really then have by design time series study and studies among children and also a little bit the pilot project in heat stress and climate change, where productivity of workers in the outdoor and also in the indoor could be very much affected. And productivity also calculations were made so that piloting can be expanded somehow for the cycle too. The main stakeholders are the Ministry of Health, big one, Ministry of Environment, Ministry of Transport, and also the city of Addis Ababa through the mayor's office. So we have started engaging these stakeholders right from the planning grant. We very much value the use of PM Monitor, BAM, which is precious to us, especially for the 4 countries, because it provides us a very long-term and accurate data. It's a kind of equivalent reference method by EPA. And most important is it provides hourly data that we can convert into a daily data, assuming 75% of the measurement of hourly should be present in that daily concentration calculation. So that's really very big deal. But otherwise, we had scientific findings so far communicated through different tools. But the first, I would say, is sensitizing these stakeholders through regional meetings. We used to have every year regional meetings, means all of the 4 countries meeting either in Addis or Kampala or Nairobi. We did that one. And very important is also mass media use, especially through radios and TVs, was very, very effective. And the last one, we have got dissemination workshop also, where we conclude cycle 1, and we have to provide that communication. But otherwise, there are some very important stakeholders in terms of liaison officers, because they are collecting data, hospital-based data. We have to inform them about the value of those data, especially admission data, discharge data. Otherwise, we'll be faced with problems of missing this data. Very important challenge that we faced is really in terms of questions addressing how comes you can say the air pollution in Addis is this much, and because you are having 1 station. So the spatial kind of variability is very difficult to do it. But otherwise, the continuous monitoring data is very useful to the city. Otherwise, we are having power outages, electricity. I think I see also in Nairobi, very frequent, and it's more frequent in Addis. And therefore, we lose precious data, because once there is power interruption, then BAM could not collect data, early data. That's very, very challenging. So I have to learn from our colleagues Otieno, because he has got very different power connection options, and we are going to adapt that kind of technology, because that technology provides a continuous supply of 5 hours, at least 5 hours, when there is power cut. And that's very useful to us as well as to Kampala. But otherwise, the very challenge from the stakeholder side is really how to communicate risk of air pollution this much level, and also the health impact. That's very difficult. Like, for example, I said for every 10 micrograms increase of PM2.5, there would be this much risk of dying. Very difficult, and not easily to understood by ordinary experts, even the policymakers. That's very difficult. But otherwise, we want to work somehow in future very aggressively in terms of policy informing, providing good evidence to them. But otherwise, so far we are sensitizing. We are making awareness of our data and also related health effects. And public informing will be the way forward. But otherwise, based on our data, what we see is really the PM level, at least even in 1 station, and there are 2 stations in the US Embassy. And instead of this, BAMs are showing very, very high level of PM2.5, exceeding too much the WHO finds. That's one finding. But otherwise, we had source apportionment also. Vehicles contribution is about 28%, showing policymakers that traffic density is very important in terms of source of pollution. But otherwise, we have shown temporal variability, and also spatial variability to a certain extent. And that's also very, very useful in a way that to show air pollution does not even have boundaries, even within the city of Addis. That's very useful, finding. But otherwise, this is what I can say from my side. Thank you very much.
Thank you very much, Abera. So I think the one thing you'll see that's common in all these projects is partnerships, knowledge exchange, skills transfer. And now is your opportunity to tell us in your groups what you discussed. I'm sure some of these elements were there. So if you want to change them while you're here, you're more than welcome to. I will start with, how we'll do this. Just looking at the time that we have now. So the idea is for us to listen to the groups and then put our heads together of all the options that we'll have had. And Pallavi will be helping me with this in noting down all these options. We'll then have a broad discussion to see these are our options, this is what we feel we can do, which one are like the most critical ones and how can we go about it. And maybe, you never know, Bob is here. He's our ears on the HEI side. We may want to do one or two things, but no promises there. So I will start with group 5. And I think the rapporteur, McLean, is ready. So I'll be giving you 5 minutes to do your presentation and an additional 2 minutes for any of your group members to make additions to your submission. Also, the 5-minute signal will be when I stand up. If you want to go for the extra 2 minutes, that means your group will not say anything. So, McLean, over to you.
Good afternoon. I'm McLean Nsima, an epidemiologist from Kampala Capital City Authority, presenting on behalf of Group 5. And the group members were Bruce Chirenga, McLean Nsima, Carlos Behan, Bella Siman, Dorothy Anyu, and Jacqueline Kajima. We shall focus on 2 evidence or policy analysis gaps with respect to air pollution and health in East Africa. So despite the fact that we've had some sensors for air quality monitoring, we still believe that there is need for longitudinal and quality data for air quality. And how will this be achieved? We should utilize air quality sensors that have been licensed or that comply to the EPA standards. We should also ensure to maintain the functionality of these air quality sensors. Because if they are faulty with time, that means that we are not getting the quality data that we need. But also, in the short term, we need to conduct a data quality assessment systematic review or meta-analysis to be sure that we can compare the data generated from the air quality sensors to the reference stations. And for the long-term strategies, we need to develop SOPs for air quality monitoring using the low-cost sensors. And this should be generalized to all the countries in Africa or East Africa at large. And we should also be able to conduct source apportionment and emission inventory so that we can easily speak out or be able to communicate to the policymakers on what exactly is causing the air pollution, and then can be able to come up with the relevant and appropriate interventions. The responsible officers will look up to researchers, the regulatory authorities, and also the government and local authorities. And after doing all this, we expect to have reliable and quality data, longitudinal data that can be analyzed and be able to inform us, and also be able to understand the sources of air pollution within our context. We also feel that we need to communicate the health effects of air pollution to the public, but in a way that they can understand. How should this be achieved? For the meantime, we need to leverage on evidence from other countries where they have, where a decrease in air pollution has improved the health outcomes. If you tell them that when there was a decrease, we had an improvement in the health outcomes, it's easier for them to understand than just telling them every other time, let's reduce the air pollution, let's reduce the air pollution, without showing them what is expected. And then also utilize best practices for packaging and sharing this information. Have stakeholder engagements with the policymakers and the public, and most importantly, to the communities on ground. And then for the long-term strategies, we need to conduct contextualized studies on the health effects of air pollution. It's easy to tell someone that, you see, in Nairobi, when we reduce the air pollution, maybe the respiratory disease is reduced to this extent, than telling them every other time in the other countries or in the Western countries. And then also estimate the economic burden of the consequences of air pollution. The fact that we are in a resource-limited setting, if we tell them, or if you're able to tell them that this is what it costs by having air pollution, it's easier for the policymakers to understand, because they understand most when it comes to the money. The responsible officers, we can have the communication experts on board, the stakeholders, and the researchers and government institutions. At the end of this all, we expect to have increased awareness on the health effects of air pollution, but also have acceptability of any interventions that you will be proposing, because they now understand why they need to have these interventions implemented. Other gaps that we did not explore, but we feel we still have them as gaps. We have limited electronic individualized health data. For most of the countries, we have the DHIS2, but it has aggregated data. But if you want to tease out the health outcomes with respect to air quality, in most cases, you need the individualized health data. There is still need for continued there is still need for the regulatory bodies to focus on enforcing air quality standards. Some countries have them in place, but the enforcement is an issue. Then the gaps in policy formulation and enforcement, the need for incorporating the air quality teaching into the education system, because if it is grounded from the start or from the early childhood, it's easier by the time we get to maybe 10 years later. And then the uptake of locally contextualized interventions to mitigate air pollution. Thank you.
Right on time. So anyone in the group want to reinforce any of the messages? You still have one and a half minutes. No? Oh, Kiros. Now you have 1 minute, 20 seconds.
Well, first of all, I think, you did a very, very good job in summarizing. The only thing I would add is actually the training part, the building, human capacity part. That wasn't emphasized enough, and that's very important for sustainability and continued engagement. Other than that, I think, it was very well summarized.
So I think no one else in the group wants to say anything. Efficient group, you did 6 minutes of your 7 allocated. Thank you so much. So that's group 5, right? Group 5. Godwin, the rapporteur for group, was it 1? 3? You're on next.
Good afternoon. Good afternoon. Okay, this is group 3. My task is going to be very easy because some of the points or challenges are actually overlapping with what the first group has presented. So we decided to adopt a matrix, just to summarize, sum it up. So one of the challenge we have is economic valuation and effects of air pollution as it relates to health, so as to make policy, guys in the policy realm to understand how it really, what it really costs, or the health burden which is caused as a result of air pollution. And so what can be done? They would need for maybe some commission studies, which are actually commissioned by the regulators as lead, so that we evaluate the cost of regulatory compliance, for instance. How much does it take us to comply? And compare it with the health-related costs, so that we're able to see why there's a sense of urgency in addressing the issue of air quality. And also, in terms of actors that will be involved, it will be important to have researchers on board. But as I said, the regulators should be the lead in this. And then we have the community and NGOs. So the whole concept here is co-production. I mean, to be able to have a participatory kind of research to be able to tease out these issues. Of course, resources, what is needed, targeted financing, human resource, of course, which will leverage from the actors, and some of the equipment or tools that are needed for this. And most important thing, we classified as a resource. We thought partnership would be very, very important as a resource. You might say it's from the other actors, but we felt as a group that it's a resource. Yeah, your network is your net worth. And we saw this would be a short-term, but also a recurring kind of interventions to address this challenge. Then number two is community perception on relationship between health and air pollution. And so this is what can be done. Let's have targeted sensitization or awareness. And we develop relevant strategies, for example, having communication strategies to be able to inform the community, but these strategies must be co-produced. I mean, in developing this strategy, there must be involvement or substantive public participation. So the community at the center, but then the lead also be the regulator. So we are looking at regulators to as leads, because when it's a government agenda, then it's easily, when they're influenced to pick it as an agenda, then it's easily implemented. So we also think of journalists who would be important and well-trained, as was earlier presented, to be able to disseminate some of this information through our mainstream media. Of course, the resources, they border the same, and this should be a continuous process through the life cycle or the cyclic nature of this awareness creation, because awareness creation is not an instantaneous event, it's a continuous process. People are born, others die, so you have to continue creating that awareness, either through infusing through curriculum or using other media and platform that are able to make them reach that. Another challenge is better air quality. There's a challenge there, but is integrated in what I've just discussed and the next. But group members felt like it's something that is bothering the regulatory authorities. People they can't differentiate between odor and air pollution. That's why it's appearing there. But then, nevertheless, better air quality infrastructure that can support and inform compliance and health strategies. We've just twisted the words. It's same things that the other group said in another way. So we are looking at inclusion in budget line items. I mean, we should have budget line items in government agencies, relevant government agencies, that actually address issues of air quality management in terms of infrastructure, the acquisition of equipment, and infrastructure-related issues. And so if there's no budget line, if it's not budgeted for and provided for, then it will not be done. And that's why the group felt that that's very important. We should also enhance local solutions facilitated by research and development, and we have a good kid in the block for East Africa like EACO. So how then do we encourage our innovation hubs to take up this? Thank you, Victor. The actors, of course, the government, lead, research institution, NGOs, community. And this should be a long-term process, but also, I mean, this should be, it's continuous, because for us to start seeing this, then there should be some element of continuity. Thank you. Sorry, I exceeded the time.
No, it's okay. You can go for 2 minutes, but that means...
No, anyone from my group.
Yeah, no one will say anything. Anyway, the group, would you like to reinforce any of the messages? Group 3, is it?
Yeah, group 3.
They are shy. I don't know. You're in.
I will be less shy on their behalf. Thank you, Godwin. You've done it well. So I just wanted to reinforce, the regulatory impact assessment bit, because that's very important, especially for our region that is newly developing these air quality management laws and regulations. And the importance is, beyond just assessing what it would cost the government to implement the interventions that they're putting in place, and also what it would cost the targeted communities, the industries, the transport sector to comply. It's also, it would be important from a air quality and health perspective to just determine, how many lives, for example, would be saved, or how many, hospitalizations would be avoided, and things like this, for if we implemented the interventions that we have determined as a community, as a society, as a country. Thank you.
Thanks, Jerry. So right on the 7-minute mark. That is group 3 for you. This is group. This is 5. That's 3. Pick a number. Okay. So that's 2. There's. Okay, you'll be group 3. Okay, so Gideon, your time. You have the floor.
How many minutes?
You have 5 minutes.
Okay.
And 7 minutes if you want. 2 minutes for people to say something from your group, so 7 minutes.
Okay. Luckily, you presented most of the things we covered, so I'll be very brief. I'll try my best. But from our group, we thought about the 2 questions and how to address them. Okay, just a moment. I hope you're not taking my time. All right, so we thought about the ideas that we were to discuss, and we thought about it in terms of the questions that we had. So the first thing we thought about the short-term things that can be done. We realized the challenges mostly on the data awareness, and also working together on knowledge gaps that we have. So on the awareness part, there were 2 scenarios where we talked about the community awareness as being part of the most important things that we have to do first. But then again, there was a comment that if you go to the community, you might not even achieve anything. So targeted awareness to the policymakers as another point that is not just within the same realm. We also thought about participatory kind of working together, co-designing these solutions. And in this, we thought about like groups working together to solve the same air quality problem in different angles. Like we have the clean cooking group that is trying to help families get cleaner cooking solutions, but at the same time, they are also contributing in the reduction of the air quality problem indirectly or directly. And on the short term, again, we thought about now exploring behavior change interventions, like reaching out to groups to talk about what are the things that we can do together as a person from your own small kind of actions to live a healthy life and reduce the effects of air pollution. And an example was talking to individually, trying to do things like opening up windows a few times a day and other activities. On the long-term ones, there was policies, checking the effectiveness of them, not just formulating policies, but also ensuring that they are as effective as they should be, as things that can be done in the long term, because when you talk about policies and checking the effectiveness, it can take 3 years. You have to do more than, take longer to make sure they are as they're stipulated. And data, specifically targeted data for awareness. A good example that was given in the group is targeting people who are actually really affected, like the traffic police. It can be done when such groups understand the effects of what they are breathing or what kind of environment they are working on. They can push for change in the long run. And we thought about the air quality and health problem as an investment issue in the African setting, and closing the investment gaps, trying to get the funding, the right materials to use in this space, would also support in the long run. And the technological interventions, the other groups talked about innovation, supporting groups that are working on solutions that could be useful in this specific field is one of the things that we can do in the long term, because such innovations take time to mature to a stage that can be useful. And bridging the knowledge gaps, talking more about using the data to support policy formulation is one of the long-term things that can be done to resolve that. Concerning the skills, we just split again in terms of those groups we put together. In awareness raising, we need to get better tools, digital tools to communicate. A good example is apps that, for example, ECHO is using in this case. Media houses getting engaged in the work that we do, fronting what we do, talking about air quality data. Some of the resources are in that realm. We also talk about telecommunication companies participating actively in sharing the message and the skills. Investment funding, accessing funds that would help in forwarding the work would be something that can be done in the long term, and it could be a useful resource for the teams working in the field. And on the knowledge gaps, I'm just trying to rush through, is trying to promote climate technology development, skills and training in institutions, in situations like this, like the training that we will have tomorrow, is one of the things that can be included in the investment part on the knowledge gaps. Finally, the challenges were just to cover up what we were talking about, how we got to those solutions and suggestions. Where we thought about the entry point as an important point. And I think my group has a lot to say because I really rushed through. If you have anything, please, maybe we have 1 minute for you. Thanks.
Yeah, so we have 2 minutes for anyone from your group to react. We're giving them 3, group 3. This man was in group 3. Okay. Okay, group 3 is here. So.
Yeah, I just want to tell a small story because it's in the afternoon. So there was a comment there that was sometimes when you talk to certain community members, you might not get the results you want. And I want to demonstrate this with a small story of my grandmother. I went to see her when I was in school studying air quality, air pollution. And I told her, you know, Grandma, cooking with these things is going to kill you. She looked at me carefully and she said, we took you to school to become smart, but it seems you're going on the other direction. And she said, your grandfather was actually not cooking. He never came to the kitchen. He died at 60, and I'm still here at 80. So targeting certain communities might not work, especially my grandmother.
Interesting. Any other story from the group without a number? Oh, number 6. Okay. Thank you. That is a good story. So this group doesn't want to lose number 2, so I've asked them to come next. Are you ready, Simiyu? So this is group 2. Okay, please go ahead.
Okay, thank you. Good afternoon. You seem to be tired. Mine will be very brief because actually our group, I think we took a shortcut and we decided not to go to many issues. So the membership of the group, as you can see, we had Karadi, who was leading the group. We had myself, Alex from Uganda. We had Selela from Kenya. We had John from the US. And finally, Abera from Ethiopia. So in our group, we started by looking at the challenges. Before we went to the priorities, we looked at the challenges. And basically, for us, what came out clearly, and you can as well look at all the deliberations that took place yesterday and even today, issues to do with data were coming out clearly. And our focus, basically, we were looking at air pollution data because it was so clear that even in this room, there are many researchers with their different data sets. GeoHealth, they have their data set they've been collecting on for some time. We could be having another researcher who has also their data set, but if you ask the other researcher, they don't know what the other person is doing, and they're not openly sharing this data. So those are some of the challenges. And then the fragmentation, of course, as you can always see. Then there is a very major disconnect, especially when it comes to between policymakers and researchers. So researchers have done a lot, especially in this space. However, when you go to the policymakers, they talk a different language. It seems their problems are increasing, yet the researchers are still doing research, and we always hope that research is done to identify gaps that informs policy. But on the other hand, when you go to policymakers, actually they were raising more questions than answers. So it seems the policymakers have more research questions than the researchers. So that is one of the issues as well. And just to add on that, one other issue is, as policymakers and researchers, we are all working towards serving the resident, the common mwananchi. But if we are talking two different languages, then that means we will take our own confusion as well to the mwananchi, and that will be very dangerous, and it might even derail the efforts that have been made individually by the researchers as well as the policymakers in implementation. So another issue which we cannot ignore is funding. Of course, all these interventions you are talking about will require funds. So then lastly, in terms of, took a regional approach, which is good, but at the same time, it presents a very major challenge because you are dealing with different countries. So looking at countries within the region, their priorities are not the same, and their willingness to take up some of these decisions might not be so easy. So for instance, maybe we took the approach of the East African community. So you realize some of the members could not be willing to do to partake on some of the interventions or to implement some of the measures that you pass as the community. So that presents both as an opportunity but as a challenge as well. So when it comes to the three questions that we were supposed to handle for the group, the first, there were several various topics that were raised by the members, quite a number, ranging from the limited type of monitoring campaigns. Somebody raised from the group, we've been, if you could listen to the presentations, we are always talking about PM 2.5, PM 2.5. Does it mean it's the only issue that we have when it comes to air pollution? So that could be very misleading, considering that the impact of air pollution is not only guided by PM 2.5, so other gases like sulfur dioxide, carbon monoxide, the NOx. So somebody was asking whether that can also be put as a priority. Another area is, of course, the repository for air quality data. We all agree when it comes to air quality data, there is an issue. We don't have a central, whether at the national level or as a region, we don't have. But for for mobility data or health-related data, we all agree that to some level, if you need data to work on, and even from the presentations that have been made here, we can all agree on when it comes to the health effect, the health impact of air pollution. But when it comes to the quality, in terms of quality, in terms of access to air quality data is a challenge. Then several studies have been done. How comes we are not implementing these studies within the region? So regional networking is also a problem. So our group focused on one concept. We felt this could address almost all the issues, and this is establishing a regional environmental public health tracking, and this could ensure that it includes air quality data. This is not a new concept. It has worked elsewhere. It's already in the CDC in the US. So with reservations, somebody raised at the time it has taken for them to come up with this. So we put that into consideration. So all this is a medium-term measure, considering that something is already existing when it comes to health data. But for the air quality data, of course, there is a lot to be done. And also something that came up through NEMA, they've already working on East African emission standards. That is 1047. This we see is as a long term, because it will take time for all these countries to buy in. Then finally, when it comes to the actors, we agreed that this cannot be done by one person. It cannot be done by one actor. So it's a joint activity which has to be done jointly by policymakers as well as researchers. And the policymakers, basically these are the people who are going to own this process, while on the other hand, researchers to drive in terms of data and of course developing the tool. And we did not leave out development partners, because without funds there is nothing the two can do. Otherwise, thank you.
Thank you, Simiyu. I will give just 1 minute for any reactions from your team, group 2. Or any additions? No? Perfect. So we'll go to the last group, group 1. Lydia, please join us at the podium.
Good afternoon. Yes, this is group 1. As you can see, we are a total of 7. So basically for our group, I think our approach was quite different. We thought that a lot has been done, and basically we looked at it from the point of, yes, we have the data. What is the data doing to us, and how best can we use this data? And then how can we use this data to solve some of the problems that we have? So from that, we had about 3 focus areas. And as you can see, one is limited access to air quality air quality pollution, air quality or rather air pollution data. So the second one was communication of research findings to policymakers and users for adoption. And the third one was commitment to action and intervention based on evidence. So on to the first one, limited access to air pollution data. So we recognize that a lot of institutions, as we have seen, that everyone has done something around air pollution. But then where is the data? Again, NEMA mentioned that, yes, they know that there are institutions that have done one or two things on air pollution, but they don't have the data. So in short term, to achieve this, one way was to coalesce and create network of all stakeholders involved in air quality management and research. And this could be through creation of technical working group, basically through NEMA and MOH. We also recognize that Clean Air Catalyst started this, especially in Kenya, and has tried to bring most stakeholders together. But we asked ourselves, Clean Air Catalyst is just like a 2-year project. What happens after that? Then this is whereby we call in the government through NEMA to ensure that this continues even after. So besides that, there should also be an establishment of monitoring and evaluation plan to at least monitor the progress and what exactly are we engaging in. Then another short-term goal was setting aside a budget by the government for air quality data and management, because, well, we have the group, but then how do we ensure that the activities are run? Then the government in that case need to come in and at least have a budget, which at the moment does not exist, to ensure that this is running. Then for the long-term goals, there is need to have a centralized data access platform. I think that has been talked about. Then implementing the monitoring and evaluation plan for database. So short-term, let us create it, and then in the long term, we have to really implement the monitoring and evaluation aspect. And also there is need also to build capacity, being that we are looking at the government through NEMA to be the one in charge of the data. Then again, there is need to build capacity to ensure that the data is well managed, and in fact, the correct data is with them. Then area of responsibility, who is responsible for this? Basically the government and the researchers. To the next then, well, we have the data then, and we have the findings now. How do we communicate this? So our point was communication of research findings to policymakers and users for adoption. In the short term, we've all said that there is need to use very simple language to ensure that whatever we find from scientific research is well understood by the people who should be taking it up, be it policymakers or the local people. So look into the language that we use to disseminate our findings. Then there is also need to publish policy briefs, because not everyone will take our papers and read everything. So an easier way of reaching especially the policymakers is need to come with policy briefs out of every research that we do. Then active use of national events. I was really happy to hear that Uganda mentioned that they have a whole week of Uganda Air Quality Week. But then we asked ourselves, we Kenyans, what do we have? How then do we recognize that across the nation, we recognize that there is need to tackle issues around air pollution. So then we need to come up with something like that. Then again, using the media platforms to create awareness. How often do you ever see through our TVs or through the radios, how often do we talk about issues around air pollution? Then that's something we should also be keen on. Just be very intentional with it so that the message is passed across. Then in the long term, we also thought that it's important at least to incorporate issues around air pollution, and if they exist, then there is need to review them. Look at what has been there, and is it still relevant? If not, then we need to review them so that they are updated to the current. And who is responsible for this? We have communication experts, then we have journalists who also relay this information, and then we have researchers. And then on to our last one, then fine. We have the data, we have our findings out there, then what do we do with these findings? So there is need to ensure that there is action taken. So in the short term, there is need to engage all the stakeholders from the onset and even at the point of dissemination. Make sure that we have the community on board, the policymakers are on board, and even the policymakers, community, and as well as I think the researchers. So Nema previously mentioned that right now they're in the process of revising the air quality regulations. But if I may ask you, or if I may just pose a question to you, do you have the policymakers represented? Are the researchers there? Are the community represented? At least to ensure that even as much as we have findings, all these people, they know what to do at the end of it, or the role that they play. Then there is also need to target the relevant audience for research findings and dissemination. Whenever we are doing our research or at the point whereby we disseminate our findings, who do we want this information to get to? Is it that your findings are based on policy, but you're targeting probably the community? So always be very keen. We need to be very keen by who do we target with our findings so that it gets to the right person if we expect implementation. And then another one was actively advocate publishing scientific evidence-based research. We find that most of research are done, but are they published to get to the right people? We find that we do a lot, then we keep our results with us, and it doesn't get out there. Or it takes too long. By the time that it's out there, then it's like the data is not matching the current status of air pollution. So we should focus on publishing and again doing it within the duration that should be accomplished. Then then focus on feasible action based on recommendations. Again, we realize that most of the findings, we have recommendations that we make, but are they feasible? So again, for the researchers, as we do our recommendation, we should at least come up with those that are feasible and make sure that we implement them to at least achieve the change. And on the long term, there is need to advocate for creation of budget. I think we've mentioned that. Again, we don't have any budget created for issues around air pollution, so we should be keen on that. And there is need to actively mobilize resources for air pollution work, I think more or less in relation to the first point, and then create or strengthen network in East Africa and beyond. We are glad we are here. Kenya and Uganda is represented here. Probably it's also necessary to bring Tanzania on board so that there is need to share information across on issues around air pollution. Who is responsible for this? We have the government, development partners, researchers, community, and policymakers. So generally, everybody should be on board for this. So that is for Group 1. Thank you, Victor.
Thank you so much. I see members of Group 1 in discussion here. They must have something to say. So I'll give you just 1 minute to add.
Thank you very much. Fortunately, I sat with Nema here, Kenya. So this we didn't discuss in the group, but since I was very much involved, I thought that maybe one of the problem number 2, which was communicating research to users, I thought that maybe it might be good to use this low-hanging fruit, which is sometimes ignored, like the inter-religious councils, because in our East Africa, we know that we are quite faithful and we have a lot of faith. Either we are Muslims or Christians or whatever it is. So I'm imagining if a priest or a bishop, for some reason, came up and said, you know what, we must breathe clean air, otherwise we are dead. I am certain that there would be a lot of, that's good advocacy, because most people would believe in these individuals. So I think we should take advantage of this platform of religious institutions to disseminate and encourage adaptation of some of these things. Thank you.
Thank you, Lynn, for those additions. You know, what we are going to do next is we are going to open this up. So I want to save that energy for then. Or you have something outside of this? So what I want us to do is to take a short break so that we can have tea. And we have already heard from everyone in terms of what every group feels is critical. There's overlaps. So we're going to come back and shift through all that and have a broader discussion. So I want to save your energy for that time. So let's do what, 15 minutes tea break so that we come back and do that. And our colleagues who are connected virtually. We'll maybe offer an opportunity for 1 or 2 people to also, participate in that discussion. So we'll be back in 15 minutes. Thank you so much.
As we go into the group discussions, the final round of our group discussions, we've been spending a lot of time hearing to everyone who is here in this room, but there have been several people participating and following all of our discussions online. And a couple of them would like to share a few words of wisdom or their sort of insights from everything they've heard. So if I can please have silence in the room so that we can hear our online attendees. So Dorothy, over to you.
Hi, it's nice to see everyone, familiar faces in the room. I'm Dorothy Lesotho from the University of Wisconsin-Madison. Yeah, I want to go off like Professor Lynn Atuyambe's comment. We at the university with the Nelson Institute with Jonathan Patz, Professor Jonathan Patz, we work with, we collaborate with Professor Lynn Atuyambe. And from his comment of like having to involve religious leaders, it's something that I thought about while I was in Kampala last summer, talking about involving like other people in these conversations was the cultural leaders, at least the cultural institutions in Kampala or in Uganda. And I think we have similar things in Kenya, the cultural leaders, because I feel like especially if you're working in Kampala and you're not working with the cultural institutions that command a lot of respect from their tribes and clans and people like these, then we miss out on people who would help spread the word on pollution and, taking part in these conversations. And I thought it was something that we miss in our conversations, at least on the tables. We don't see these people represented, and we have to maybe find out pulling them in because they already have established parliaments as well. And so just pulling in the cultural leaders, I think, would also be something very important that we should be thinking about, at least in Kampala. Thank you.
Thank you, Dorothy. There was one other comment that I do want to share with the group here, which was from Solomon, who has been attending all of the sessions over the last 2 days. And his comment was about the fact that we've almost exclusively focused on ambient air pollution. We haven't spent a lot of time talking about household air pollution, and considering that household air pollution is a big problem in Africa, why we decided to ignore that whole issue and just focus on what we could do towards improving urban air quality. I don't know if there's any folks here who would like to comment on that. I think I can speak to it as one of the organizers for the event. A lot of the work that we do at HEI does focus on ambient air pollution, so that's our primary area of interest. We also know that household air pollution is an issue that is being tackled by a variety of other organizations, including the excellent work that Nancy presented earlier today. So we completely and truly acknowledge that household air pollution is indeed a problem. It is something that we need to keep working on. Also because whatever we're burning in our homes is not staying in our homes, it's going outside. So ultimately, the ambient air pollution issue also needs to take into account household. And I think we will try to bring it more clearly into future conversations, but given the scope of our work, we will try and focus more on ambient air pollution, at least for the time being. But we welcome other people who are in this room here who may be working on household air pollution to find ways for us to connect and do things together. So what I wanted to do, and what I have hopefully done to some extent, is synthesize the really nice ideas that the different groups presented. And I will try and go through them. They're not organized by group anymore. They're just ideas that people had across the board. So just to get the initial set of challenges out of the way, what different groups thought were important gaps. We have limitations when it comes to data. We have some degree of disconnect between researchers and policymakers, what we are interested in, how we are using different pieces of information. And I actually really liked one of the points that was made about, how we are thinking as researchers, what we are producing as science can sometimes, if not done correctly, misguide policy decisions. And I say that because in India, we have seen that happen multiple times, where people have done source apportionment studies. They have found somewhat conflicting results because their data and methods and assumptions were different. And the government very quickly picked those up and said, hey, no one knows what the real problem is, so we're going to do another study and then move on. So really important point as more research happens and as policymakers and scientists start working together. Another issue that I think came up was gaps in policy formulation. We discussed some possible ways forward for that as well. And then another big one was gaps in awareness. Who are the really important populations, not including George's grandmother, who need to be aware and informed about air pollution issues. And then funding, of course, I think always underlies a lot of these conversations. So if we start with sensitization of communities, you'll see words from all different groups mentioned here. But I think the gist of it was we need to know who we are communicating to, who our target audiences. We need to know what matters to them. It may not be air quality, it may be something different. And then it may not just be the public. It may be that we just want to focus our communication on policymakers or on journalists. I think that came up also earlier today. And in doing that, leveraging the information we have available now, so we don't have to wait for this new data and new information to become available. And using different strategies. We can use media, we can use policy briefs, we can use talk shows and radio shows and other things, but trying to keep in mind that we need to use simple language. I think Selela said this in the morning today. Yesterday was all about science, and today we will speak in English. So I think really important point to keep in mind as we think about this. And also that this is not an activity that happens one time. It continues to happen over time. Maybe we become more sophisticated in who we target. Maybe our messaging changes. And this was an idea that was reflected in multiple groups in different ways. So I want to take maybe 5 minutes to see if people have any ideas on work that could be done, like tangible ideas that we have in the room. I know there are people here who have really good communication expertise. So if they have suggestions or thoughts on maybe 2 priority audiences, because we can't go to everyone at the same time, and then what the best ways to reach them might be for us. And if no one raises their hand, I know of 2 people to pick on, so I can start with those. George, would you like to talk a little bit, since your Clean Air Catalyst project is focusing on that quite a bit?
Yeah, absolutely. Thanks for picking me. I was just about to lift my hand. One of the very interesting example we have under Catalyst, during the International Women's Day, we went to some of the TV stations in Kenya, and we were promoting gender perspectives to air pollution. And there were people who were calling into the radio show, and there was a gentleman from, I think it was Moranga, who actually called in and said, I actually think my wife died because of exposure to air pollution. So that was so powerful. And one of the things we want to do, and I really hope we can actually partner with you on this, is kind of develop a feature for that particular gentleman and try to air it in a couple of stations, which I think we'll kind of have a wake-up call. So before that show, the gentleman was confused. What killed my wife? But when we did that presentation, he was able to make that link. And I think there is need to do this. So again, so that is the first category. Media is very powerful. It reaches a lot of people. And if we can develop the feature ourselves and partners from this group, then we can be able to air it in a couple of stations. Right now we have an open offer from KBC, but they want to shoot it themselves and air it themselves. But I think the reach for that will not be as big as if we did it ourselves. The other major partner that I think we need to engage with is actually the medical community. And I think Jackie, yeah, she invited, she has a conference happening in Mombasa, where they bring all these medical practitioners from across the region And I think we should at least have a representation or 2 or 3 from our organization to really go and talk to the doctors. When we talk with the doctors, you can see the passion, and when they create that link, they're usually very keen. But that conversation tends to die off. So instead of us talking to ourselves all the time, let's get to the medical community and then talk to them. Because you said 2, I'll just stop at 2.
And also, if we are communicating to the communities, irrespective of the illustrations or the graphics we can present to them, there is much needed for the person communicating to become or to appreciate their well-being. Try to resemble them, put yourself in your shoes. They will appreciate you more if you're like them. But you come with a different perspective, trying to be high, they will not even get anything. So that type of communication will also help us digest that information we want to put to the community.
Okay, thank you very much. I'm not an expert in communication, but this is just from work experience. When we find that the scientific information is very hard to policymakers, what we have done in the past is to engage science journalists, not just any journalist, science journalists. And we used to work with the magazine called Science Africa. Then we publish what we want to communicate with them in that magazine and put it in the pigeonholes of members of parliament. And that was very influential, because then when the policies went to parliament, the regulations went to parliament, the parliamentarians felt familiar with what was being discussed. Also, we had specific sessions to communicate the policy needs to the parliamentarians. And it's not just taking the parliamentarians in general, taking a specific committee that is responsible for environment, agriculture, air pollution issues at parliamentary level and at the Senate level. And then in Kenya's situation, we have women's representative. And then we'll have a special session just for women's representative. That is unpacking communication. I think because I have the mic, I could also just make another comment, which another observation I made, is that we are talking about the gap between science, policy, and users. We need to unpack the users. So that is not so general. And one of the user groups that we have really forgotten, and in my view are very important, is the business community. We typically call them the private sector. Because I was just saying that in the situation like I was talking about the wearable sensors, which can be given to children, if the scientists have come up with that technology, then we need the industry to manufacture those gadgets, but within the standards of a sound sensor, you see. So we need the industry to be brought very strongly on board. My third and final comment is on just a question to this audience. We have cited a lot of disconnect between science, policy, and also between institutions doing their own research. We have the Health Effect Initiative, we have Clean Air Africa, we have CCAC, we have who else? There are many. We have GeoHealth, you know. And then we have countries, Kenya, Uganda, Tanzania. We are talking of the EAC. Can we, could we consider that having an Africa transboundary air quality convention, or could that kind of infrastructure help us in consolidating actors and actions together? Yes, no? If yes, how do we go about it? Thank you.
Okay, thank you very much. I think I would propose it's also important to target the community at this point, because in this room we've been talking about researchers, we've been talking about policymakers. However, there is a gap when it comes to communicating, because the science is there, but how do we ensure that we package this science, we interpret it we put it in a very plain language that the community can understand. So this we can do through health, targeted air pollution or air quality health messaging through the existing healthcare structures within the country, because I believe we'll have a greater impact if we reach out to the community to own up this issue, as opposed to what we've been doing for over a very long time, just among policymakers, researchers. It's just revolving around there. So I think that is an approach that will yield more results. Thank you.
Deo, before I come to you, I think I want to tell a story. I'm taking quick lessons from George here. And this point that you made about meeting the community where it is and also simplifying the language, this is my own story. So when I started working on air pollution, my parents were like, what is this like abstract thing that you're working on? Why does it matter? And it took me 5 years and an air quality monitor in the kitchen of my mother while she was cooking to make her believe that this is like a problem, because the numbers started going up as she was cooking. And with Indian food, we fry things a lot. So she could see that as soon as she started cooking, numbers started climbing up. They didn't come back down as quickly. She was cooking with gas, she had ventilation, and that was still happening. So sometimes it can be really, really small things that we would not even think about as scientists or as policymakers, but as people, I think we can. So Deo, over to you.
Okay. Deo got his chance and is trying to nominate me. Yeah, but I think without the risk of sounding repetitive, of targeting the community, I think one of the pathways could be through the religious leaders, the elected leaders, having community champions. They could be sports people. They could be. I know Ethiopian athletics and Kenya athletics have done quite wonderful with trying to integrate, community champions in that. Collaborative involving the youth is quite powerful. Whether you're talking about youth in school or outside school, that's also powerful. There's one, the air quality run, one organized in Lagos, Ghana, and South Africa. I think that also was powerful. How, if we can find ways of sustaining such activities, that's fine. Health practitioners, as George said, there's a level of trust that is still accorded to health practitioners, at least in the community I come from. Politicians, if I put a health practitioner and a politician on the same weighing scale, I think people would rush to believe a health practitioner. And then training the journalists, as Alice, put it, environmental journalists. As sharing with Victor just a minute ago, there is actually a group of journalists called InfoNile. I think the founder is Kenyan or is based in Kenya. Info, yeah. So there are already such existing groups that we could tap into to try and align the message. Deo.
I have a story. Yeah, I just got reminded. So, one of my family members, this has become like a talk now, called me out saying, I'm always on Zoom calls every time, but I've never seen air quality improve. Like, where is the problem? I think this must have been the time for the regulations, because having late night calls, all these things, trying to get things moving. But then it got me thinking. Yeah, I mean, if maybe I've not even done a good job to try to get some converts within my own household, how then do I expect to try to influence people outside of that? It's kind of like got my thumb, maybe something. It was kind of like a good. It was a casual, but then it actually got me thinking on how best to maybe change certain things. But speak of communication, anyways. I think from a very practical kind of perspective, it looks like there is a need for multiple strategies
there can't be like one like defined approach to effective communication. And there has to be different tools and solutions developed around that. Of course, like going mainstream, again, trying to, our little is a little story from Uganda. What has been, at least we see it's been able to work, trying to integrate the different like strategies together. It can be costly on the surface, but I think the creativity is around looking around ourselves and seeing how can we utilize whatever we have available. For example, the media houses share air quality information, weather information, every day. They share traffic updates every day. What if they integrated air quality in some of those updates? Would you need to pay for that? I wouldn't think so. I think there's a good pitch for that, right? And plus similar avenues, you find, let's say if you're talking social media, with now I guess many people, kind of like utilize the social media platforms to communicate. If let's say, the partner so and so has a big following on social media, and why can't we, try to work together around that, okay? You're kind of like putting out the same message, you're just really pumping information like to the public. And I think that can be very effective, both in terms of reaching out, but also in terms of the cost as well. So you're not thinking about, okay, but no, it costs money to train a journalist or to pay them, but rather we have champions within our communities. Sorry.
Thank you. I think in the interest of time, we can probably move to our next big idea. But just summarizing what we heard, crystallizing some of the content, I think trying to get media more involved, definitely getting the medical community more involved and engaged, and then thinking about communities from their point of view rather than from our scientific or policy point of view, to get the message across to them, and not thinking about one strategy alone, but trying to think of as many ways to engage people as we can. And I also want to note that these slides are placeholders, so after the workshop we will share a more nicely written summary of this so we can all continue to use it for our future planning purposes. So I think this one is probably a lot more concrete, which was around estimating the benefits of regulatory action, estimating the costs of regulatory action. I'm not going to go into detail because I think people already summarized this idea really well. But are there any suggestions or thoughts on what a process like this might look like? Where would we start it? Who would be best placed to start it? And Jerry, I'm just going to call on you to maybe kick off this discussion.
Thanks, Pallavi. So for this, I would think, government regulatory agencies would be best placed to lead. But for, best outcomes, of course, co-creation with other stakeholders would be key. In some of the East Africa countries like Kenya, for example, this is something that, they have tried to do with other regulatory processes. Currently, Kenya is reviewing the air quality regulations and standards, and I am made to understand that this sort of assessment is also underway. The scope of it is what I'm not very clear about. Maybe Selela can speak to that. But if we can make sure and take advantage of some of the existing or ongoing processes such as this to make sure that all the aspects that we think could be important for this kind of assessment are taken into account, then that could be quite helpful. Thank you.
Thank you. I will speak from the household air pollution aspect in terms of estimating the economic burden. What's currently happening is that we are partnering with the private sector to be able to quantify in terms of not just the cost. For example, in schools, for a long time, we've been doing transitioning in schools based on cost in terms of how much are you saving, how much do you spend on firewood, and how much do you save in case you transition to clean energy. However, there's been need to actually quantify the health aspects in that regard. So the quantifying of the health aspect is looking at missed work days by the cooks. We are also looking at the hospitalization and hospital visits. We're also looking at the long-term effects. There's actually a school that transitioned because the cook retired blind. Because this was impacted from the smoke that is eye irritating. And so the school transitioned based on that if we are going to be retiring every cook blind, then it's not good. At the household level, it's called cost comparisons have also been done. And we do the same actually in the job aid, which is used to communicate to the households by community health workers. We have a cost comparison tool where the household member is able to compare the current energy being used at the household and what it would mean if they transition. So this is just in terms of money, but also the conversation prior to the cost comparison is looking at the health impacts. So yes, I think it has been a score in the communities whereby most have transitioned based on cost comparison analysis, but also, and that's how the model of pay as you consumed was developed and implemented, because they were looking at if you're able to pay in smaller amounts and I'm still able to exclusively use the gas and you just refill the full gas and then I pay in small amounts, then it's great. So yes, estimating economic burden of air pollution is great and it's working and it's enabling people to actually reduce emissions. Thank you.
Thank you, Nancy. George.
Yeah. Let me stand because it's an afternoon. I have three points. The first one, I think we need to decouple the two. We need to do the economic burden separate, and then the cost of compliance separate. And the cost of compliance can actually be something that we do with NEMA to kind of develop like the best available retrofit technologies for industries. But estimating the cost burden, I think is so critical. And I think we need an independent scientific group to study that. And it has to have very good relations with the city. One of the things, I think I mentioned this yesterday, the city collects really good data at the hospital level. When people come, why are you visiting, what kind of ailment, what kind of treatment, and they do have that data. And this is where they are able to say 30% of our health cost is because of upper and lower respiratory. And then from there we can estimate how much is the city spending on these issues. So that's my second point. My third point is actually quite ironical. I find it very ironical. We say 1 in every 8 people who die in the world die because of exposure to air pollution. And at least I'm aware of 2 autopsy reports that said somebody died because of air pollution. And the first one was actually in UK in 2020, and it created such a buzz. So if 1 in every 8 people is dying from air pollution, we should at least have a couple of thousand. I don't know what is a missing link. Yeah.
Thank you, George. Dorothy, I see your hand up as well, so we'll maybe take the last comment from you.
Yeah, thank you. Well, let me just, from my own experience working on a World Bank funded project, STOVE project, even when we showed people the costs and the benefits, they still, I mean, like the presenter that showed that, I don't know what her name was, I forget, I'm sorry, but like showing the cost is good, but like the way people think is very interesting in the communities. So, and this is a conversation that I was actually grappling with the late Kirk Smith, Professor Kirk Smith at the University of Berkeley. But like for me, I think, in my opinion, working with communities and trying to like encourage them adopt clean cook stoves, sort of like walking away from the cost and finding a way, like you see how the Tesla has become, like it's a way of when you drive a hybrid or when you drive an electric car, you're kind of you're saving on, like, you're cutting down emissions, carbon emissions, and all the things. But that's not the goal of why the Tesla was created. It was like manufactured. It's branded as cool, as whatever. So if there is a way we can sort of like brand cooking, clean cooking as being fancy in some ways, I think in a way it would encourage more people to take on the cooking with clean technologies, and that way we are getting to the benefit of it. Because I get frustrated working in communities and I'm like showing them all the numbers, showing them the figures, but that's not just how they think. It's different. And I'm happy that you've had some success in those areas, but I still feel like it's still a thing where you're going to run into where even if you show people the numbers, they don't really think like that. So just finding ways of branding it in a way that is like cool or whatever to encourage more people to adopt, and then in a way you're also targeting your main goal. Thank you.
Great. Well, thanks to everyone here. I think there were a couple of concrete ideas for us to maybe take forward on this front. This other one also was something that came across in multiple groups, and I think came across in all of the presentations we've heard in the last 2 years, which is that we need a better air quality infrastructure. And there's a variety of ways we can do this. We need budget lines. We need budget lines to include air quality. And I can, again, sort of, saying this from the Indian experience, that is starting to happen, and it is making a difference. So I would 100% get behind that idea that if there's a budget line associated with new monitoring or any other type of activity, I think it just creates better incentive for the cities and the states to act on it. And then there were some really interesting ideas here on expanding our focus to maybe a variety of air pollutants, not just focusing on PM 2.5, but what's happening to sulfur dioxide, nitrogen oxides, etc. And that we need some kind of a clearinghouse or a repository. And I think different groups brought it up in different levels. So some wanted national, some wanted regional. And then also within this, thinking about local solutions and local ideas. What can we do with what we have? So I'll stop there and see if people have thoughts, comments, reactions on this, because this was coming from every single group. So I'm sure people have thoughts on this. I can pick on people if you want. Okay, so
Well, as you're thinking of picking someone, let me. I saw you looking at me, so. And, the thing about the inclusion in the budget lines, I just wanted to shed some light on it. I hope we're all looking at it from a perspective of it being included in the infrastructure of the institution as an infrastructure, not just as a budget line, because people come and go from offices, but if it's part of what is mandated and part of the institutional infrastructure, then if, let's say, Victor left office, then another person who's coming into the office will take it up. So it's very important to look at it in that way. Just wanted to clarify on that.
Yeah, I think that's an important clarification for sure. I will maybe pick on the GeoHealth group, because you have been running reference grade monitors, and as you've seen, it takes time and effort to run them well. But would you have any thoughts on how this could be scaled up? We have 3 stations across 3 countries right now. Where could we take this?
Yeah, thank you very much. And I speak from the Ugandan side. I'm sure Oguge and Abera may. But I think what I've seen as the biggest problem we have is the capacity for samples for analysis and the cost involved in shipping them and then returning them, or storage in very low temperatures, which is a cost. And I'm also, Alex mentioned it, that they ship samples, I think, to France. So if, first of all, training, a training budget maybe by government, supporting the previous point, would be available, so that there is increased capacity for laboratory, either in universities or in INEMA and human resources to be able to deal with this, that would be much more appreciated, including the spare parts and everything, because these things require to be maintained. Yeah, thank you.
Okay, just to add something on the same. Yes, like now the infrastructure we have for the monitoring, take the case of Kenya, let's say, and it replicates across the entire kind of all the countries. One BAM, which is a standard equipment plus low-cost equipment, e-samplers. Now these are in limited locations. This is an NIH-funded project, of course, plus of course a bit of IDRC. It was supposed to have been seed money, meaning, really, it's supposed to have grown. It's supposed to grow. There are many stakeholders who are supposed to come in different other aspects. So that starts bringing in the angle of who are actually supposed to be the local kind of contributors. That was supposed to be seed money. Two, when you look at even the general kind of the structure of the work, the indoor quality, air quality there has been mentioned a few times. Of course, the ambient air quality, yes, across all the countries, initially even Rwanda was there in the first cycle, ambient air quality was cutting across. But indoor air quality and personal exposure was like now looking at, let's say, just some 30% of the sample that you're supposed to have. Only 2 countries were able to do that. I think Makerere did it, and Ethiopia. We are talking about something which should have been continuous, but then because of lack of funds, it's not able to run around. So it sort of emphasizes the need for us to sort of make this thing not just external funder kind of driven, but it should be actually owned by all of us, starting with, let's say, the national governments. I think if we really mainstreamed it at country level, and then, of course, we spread it onto now the countries, because our 47 countries have got ministers that are in charge of environment. In fact, environment is a devolved function, so we have NEMA is here, Minister of Environment, but the resources and other personnel at those other levels. So basically, and that's why engaging more and more of the stakeholders, going up to those 47 countries becomes key. They may be the leaders, but they don't understand the reason why I should bring them this issue of air quality, not knowing that they are spending much more money on treatment when they could actually avoid it if they actually went into prevention. There's been a lot of competition in Kenya, let's say across the countries, trying to develop what you call referral sort of hospitals. That has been the focus. But you see, when you look at it, it's actually curative. So unless we actually go out of our way to start alerting our people at those levels that you see, these things are actually trying to chase the wind, because by the time you finish, yeah, the same things that made people sick is still here with us. So I think that awareness, going back to there, so that at country level, people have got money spared specifically for this kind of work. Now going back to cleaning air limited monitoring campaign, there was
like
something.
A repository for air quality data, so one place.
Yes,
where
yes. So
we could
repository.
have one center.
Yeah, actually, that's the most important one. Our limited kind of capacity to be able to sort of have, let's say, maybe this is a university-based kind of work. And of course, I, as a university kind of person, and my colleagues here at the university level, we know we have got one weakness.
Mm-hmm.
We think of publications. That's us, a major weakness. And we need other people to come and join us so that we start softening this stand. Because it takes long, I tell you, it's a long process. So we need other people who think differently to be able to push. And I'm happy that it's something that we have been pushing, and I must appreciate my leaders in that work, Kiros, John, and Akinabera, and Lynn, who are actually pushing this agenda now into open data access. Mm-hmm. It has been a most frustrating kind of thing. data for what? Margaret asks that question all the time. In fact, the moment I see her, that's the question that comes to my mind all the time. So it is a space that we must talk seriously about, and because at the end of the day, and I'll go back to that statement I said earlier, that air quality, whatever we do, it must impact humanity. It can't impact humanity through papers alone. There must be papers plus other value. Thank you.
Yeah, thank you. I will go to Godwin, and then Karadi, if I can put you on the spot to maybe tell us a little bit about how this has worked in South Africa, because you mentioned a data repository where you can get everything. So just in the interest of time, Godwin and then Karadi.
Thank you, Pallavi. I'll come from an angle where looking at the manufacturers of this equipment, the reference monitors, and even the low-cost sensors. Because the purchase agreements that you have with the manufacturer, you need to bring them into collaboration so that you have fair purchase agreements. Because there are institutions or even organizations that are forced to actually take back their equipment to the manufacturer for repairs as an after-sale service. But the cost of doing that is so high because you have to ship it in, ship it out. And some of them are not very, they don't really collaborate in towards issues of capacity building. And if there is such an avenue, then you might find the missing link is the person to do the capacity building. So that's something that as you're working from the purchase agreement bit, you should be structured in such a way that it should enhance sustainability. That's one thing you need to look at. Also still looking at the element of sustainability on the infrastructure, we need to enhance research and development. I'm happy with what AERCO is doing in terms of low-cost sensors. If we can work towards research and development so that we have local-based, low-cost monitors or sensors, and with also very good reference monitors, which of course we have good purchase agreements, and then we maintain this to be able to provide data to inform policy. That is one area that we really need to focus on. Thank you.
So just to explain, it's called SAQUIS, the South African Air Quality Information System. You can go and visit the website. If you just Google SAAQIS, it should come up. Originally, it was being managed or overseen by the National Departments of Forestry, Fisheries and Environment, but they were struggling, so it moved to the South African Weather Service. So it essentially sits with the Meteorological Service, and the entire network of air quality monitoring stations around the country. So they're actually managed at a provincial level, but they are required to feed their data into this national repository. It's not only government stations, it's also all of the industrial stations. So the likes of our power producer, Sasol, and others, they are not obligated to do it, but they do it anyway, because they are obviously trying to make sure that they comply with whatever minimum emission regulations are in place for them. So it's an online portal where you can go and either just view the data. So
pretty much very good discussions, and you may have had ideas that you put on the table. Please keep the conversation going. This workshop is graciously co-organized by not just HEI, but we have 4 partners. SEI Africa, who could not be with us today. They have a staff retreat in Naivasha. We have WRI Africa, who are with us here, and AERCO, and the Eastern Africa GeoHealth Hub. So I just wanted to give an opportunity to 2 of those partners to just tell us what the plans are, what their plans are, because I know 2 of them have immediate plans after this workshop. So I will call on Ivy and Dale in that order. Ladies first. Ivy, you have the floor.
Thank you all. In the spirit of the catalyst, we are also addressing gender, so it's good, Victor. I see our training worked. So, yes. So the Clean Air Catalyst program, just to give you a very short brief about the Clean Air Catalyst program, is funded by USAID. It's a global consortium project. We have EDF with us. We have Vital Strategies who are here with us. We have Internews, MapAQ, OpenAQ, so very many partners. In Nairobi, we signed an MOU in June of 2022 with NEMA, and the county and MRC, they've been exceptional in supporting us as an entry point to Nairobi. And we have several activities that are planned. And when you were speaking and what we've been discussing since yesterday, it's good to see that the Catalyst is going to try and address some of these issues, so we're excited about that. So I'll just run through some of the things we have done and some of the successes we've done so far. And I think the biggest success so far is establishing the Nairobi Air Quality Working Group. And I want to give if we can clap for ourselves, because most of the members are here today. So I've never seen such a dedicated group. We had our first multi-stakeholder forum, and we learned so much. All these things about silos, I think we are slowly trying to break the barriers. We had GeoHealth talking about what they're doing. We had ECI talking about the legislations they've been trying to address. We had Vital Strategies talking about what they're doing. We had the University of Nairobi, and all these are members. Just to give you a brief about the Nairobi Air Quality Working Group, it has 5 subcommittees. We have the health subcommittee. We have chaired by the county health department. We have Kemri with us. Dr. Muitari is in that committee as well. We have Vital Strategies as co-chairs and other members of communities who are also members. And then we have the Gender and Community Engagement Subcommittee. And I think this is the most exciting subcommittee. They cut across all of them, all the other subcommittees. And Groots Kenya is our chair and co-chaired by the Community Strategies Department at the county. Let me stress that NEMA and NCCG are in all the subcommittees. Then we have the Research and Data Committee led by JQuat and KMD, Kenya Meteorological Department. Then we have the Sector Committee who are led by Kenya Association of Manufacturers. So Dr. Kaudia, private sector is there, and KEPSA as well is also involved. And we have a Policy and Regulation Subcommittee chaired by our very own Selela. And who's your co-chair, Selela? Kenya Association, oh yeah, NCCG. So it's good to, it's slowly starting to work. And I've never seen such, I'm still very impressed. We call upon them and they work, and I'll show you how they're working. I know Victor is smiling. He's part of the Health Committee and Research and Data. We ask him to be everywhere. So, so what are we doing so far? So, other than the success of the working group, through our partners, EDF, we've conducted a baseline source awareness survey. And as George had mentioned yesterday, there were shocking things we saw. So we are going to have a validation of this survey. And if you're interested in the validation, it's going to be virtual. We're going to share the results. It's going to be on the 5th of April. But I noticed some of us will be in Kampala, so we might postpone it. If you're interested, please feel free to reach out to me. I'll send you an invite just to get to know what we found out about Nairobi. Then recently, with the same working group, we did a source prioritization, a source narrowing workshop, where eventually we can't address everything. So we wanted to narrow down to 2 to 3 sources. And within the subcommittees, we identified two-wheelers and medical waste, which we hope we are going to work on. And with that, we'll move to the root cause analysis and start at preparing a long list on how to address these issues. And I believe all of us will be involved. Then we have the emission inventory. We're going to try and prepare an integrated emissions inventory for Nairobi. We've already started data collection. We are going to focus on 5 sectors. There's waste, transport, eateries, household, and industries. How we've managed to go around this is again through the working group and through our partners. ECI is going to support us, for example, with data. EDF is involved as well. JQuat, we are working with their PhD students who are working in these sectors, and then some master students as well. At household level, for example, the county has been very instrumental in supporting us with community health volunteers who are going to help us access these households in the informal settlements. And then in the high income level areas, we are going through Kenya. I always forget, George, Kara is in full Kenya. That one, I always mess it up. So Kara is going to support us in the high income level access. It's very hard to access the Muthaigas of Kenya, right? So, and Karen areas. So they're going to support us in collecting data. So transport is already ongoing, and waste sector is already ongoing. We have tried within the West sector, while you're collecting data for the emission inventory, to work with the CBOs in these communities. And I must say they've been quite amazing, and they're really supportive. I've never seen people who are so eager to support and address waste sector. So the county, please, your CBOs on the ground are doing an amazing job. So reach out to them. And then we have equipment that the CSC is going to, together with NEMA and the county, we are going to have 2 equipments, two sites where we'll have the BAM, BC, and a weather station. Currently, again, with some members of the working group, and I'll mention them, AirCo is supporting us on, while we identify the sites. I'm going to be faster. HEI, JQuat, NCCG, and NEMA, of course, are helping us identify the right sites where we'll have this equipment. And then in the spirit of engagement, in the spirit of communication, in the spirit of policy making sure they understand air quality. And just to mention, our program is addressing crosscuts: gender, health, and climate. So we are going to have a sensitization of our environment committee in the county, and we are going to partner, of course, with ERCO, COCO, and Health Effects, and ECI to sensitize these people. We also have, we've had a lot about media today, and we are going to have a media training. We have journalists. There's a call that has already been put out there. If you have journalist friends, please ask them to apply. We're going to train them on how to clearly communicate on air pollution. And we hope there'll be a change. There'll be a grant that will come in after that. And, yeah, so we are hoping we'll have bigger stories about Nairobi and how we are addressing them. Yes, and then upcoming events that I think partners here can come and see me and maybe discuss as well. The Air Quality Week, yes, Uganda is doing it, but we are also going to try to do it for Nairobi. NEMA is going to be involved. I think ERCO is also involved. USAID is involved as well, so we are planning on that. Yes, and just to finalize, if anyone wants to join the Nairobi Air Quality Working Group, please, it's open to everyone. And I know, yes, Dr. Kaudia, we want you even to be a mentor for everyone in the working group. So please feel free to, see me. We will do the necessary arrangements, and once we organize a meeting, you'll join us. So thank you all, and wish you a good evening. Thank you.
Yeah, I'll just be very quick. Thank you for the opportunity, actually. I think I'll spend the next 2 minutes talking about the Kampala meeting, and then that'll be it. So the ERCO vision is clean air for African cities. Very ambitious, but we know that at the center of that, first of all, it's highly unlikely that in our lifetime we'll see, that glossy picture, the blue sky for Africa, but we know we can contribute to those efforts. So within that very ambitious vision, we have another vision. We know that to move towards clean air for African cities, it's going to take all of us African networks. EACO is not going to be doing that, okay? So the African networks are the communities who are working on air quality on the data. Air quality is increasingly becoming a career for many people. That's good news. And yeah, so working with different partners, it's a big part of that pathway to that vision. I'm mentioning that because the upcoming workshop is really framed around that. So we envisage, we are trying to, within the two broad research questions that I discussed yesterday, we are trying to build an Africa-focused model, an Africa-focused kind of framework for air quality management. In other words, can we be able to define that toolkit, that broad framework that could be adapted, could be replicated in any African city? Okay, so that's the work in progress, and that's why the African networks are very, very key, because we know we can't do it ourselves. So the meeting in Kampala is really framed around that. So the meeting, first of all, well, I think many of you would have received already emails and so on. And we have virtual in-person sessions, and also we try to, due to demand, we try to also make it virtual as well, hybrid. Yeah, but just in brief, the Clean Air Africa Network is really, Clean Air actually stands for championing. It was quite a fine, right, to be able to actually have that rather catchy acronym. So that's championing livable urban environments through African networks for air. So just recognizing what other people are doing, but also can we bring, consolidate our efforts to define that, have that one big research paper that checks the boxes of air quality management in an African city. So that's what the Clean Air is really, really about. So the expectation is that at the end of the 3-day workshop, the engagement, we have sort of that rule book. Maybe it's like a draft zero of what that idealistic model would look like for air quality. So we have a 3-day engagement, and thanks to our convening partners, we have a fairly long list of these because of that amount of work and resources involved in doing this. The US State Department, Google, the ENABO through WeHabit, the HEI, and thanks to Pallavi Victor, SEI, Stockholm Environment Institute, Urban Beta, University of Pretoria. Some of you might have met Tolola, University of Lagos, WRI, NEMA, KCCA, and others. So kind of trying to put this together. So we have a 3-day program starting from Monday until Wednesday, when we have used that opportunity, because since we are framing around solutions and being able to define that one big, that model that is centered around solutions, locally developed solutions, we're also going to be launching the mobile app on the last day that is made for Africa by Africans. Thank you.
Thank you so much, Dio. So I think in the interest of time, Margaret. So we'll have Margaret give some closing remarks on behalf of our hosts, Nairobi County. And then she will also close the meeting.